Hello everyone! Today we'll be introducing NTD inter-series Don't Get Bitten Part 1. In this video, 3 types of NTDs will be introduced: dengue fever, rabies, and snakebite envenoming. These illnesses are well known for being spread to humans through the bites of animals, such as mosquitoes, dogs, and snakes in these cases. This video will cover general information about 3 diseases, including the definition, symptoms, medical treatment, prevention methods, prevalence, and global efforts to prevent and cure the viruses. First, we'll talk about dengue fever. So what is dengue fever? Dengue fever is mosquito-borne viral disease caused by the dengue virus. It is usually transmitted to humans through the bite of infected Aedes mosquitoes, primarily by Aedes aegypti, or also called yellow fever mosquito. Dengue fever is characterized by a range of symptoms that typically manifest within 4 to 7 days of being bitten. The common symptoms include high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding such as from the nose or gums. While most cases of dengue fever are mild and resolve on their own, it's crucial to be aware of the potential complications. In severe cases, dengue fever can progress into dengue hemorrhagic fever or dengue shock syndrome, which can be life-threatening. Dengue hemorrhagic fever is characterized by bleeding, blood plasma leakage, and organ impairment. It requires immediate medical attention. And dengue shock syndrome is a severe form of dengue fever that leads to a sudden drop in blood pressure, causing shock and organ failure. Diagnosing dengue fever usually involves a combination of factors. Healthcare professionals rely on clinical symptoms, medical history, and specific laboratory tests. These tests may include blood tests to detect the presence of dengue fever or antivirus. It's important to note that there is no specific antiviral treatment for dengue fever. Instead, treatment focuses on managing symptoms and providing relief. To control pain and reduce fever, healthcare providers often recommend the use of acetaminophen, or also known as paracetamol. This medication helps relieve the discomfort associated with dengue fever. However, it's important to avoid non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin or ibuprofen. These medications can increase the risk of bleeding, which is a concern in dengue cases. Mosquito controls play a vital role in preventing the spread of dengue fever. This includes eliminating breeding sites, especially stagnant water, where mosquitoes thrive. By eliminating stagnant water sources in our environment, we can significantly reduce mosquito populations. In addition to environmental measures, using protective measures can help prevent mosquito bites. These measures include using mosquito nets when sleeping, apply mosquito repellent, and wearing protective clothing that covers the skin. Public health efforts are also critical to controlling dengue fever. Community education plays an important role in raising awareness of dengue prevention and control measures. By educating individuals on symptoms recognition and preventive measures, we can reduce the impact of dengue outbreaks. Early detection is another important aspect of public health efforts. Timely identification of dengue cases allows for prompt intervention and appropriate treatment. This helps to prevent further transmission and serious complications. Public health authorities emphasize timely response to outbreaks. By implementing effective surveillance systems and rapid response mechanisms, authorities can mobilize resources and implement necessary control measures to contain the spread of dengue fever. Dengue fever is a major global health concern, particularly in tropical and subtropical regions. Each year, approximately 390 million dengue infections occur worldwide. Dengue outbreaks can happen in both urban and rural areas, especially during rainy seasons when mosquito populations are high. The number of dengue cases worldwide has increased significantly over the past 2 decades. There are more than 5 million reported cases and more than 5,000 deaths attributed to dengue each year. Dengue is endemic in more than 80 countries and territories worldwide, spanning the 5 WHO regions: Africa, the Americas, Southeast Asia, the Western Pacific, and in the Eastern Mediterranean. Several public health strategies have been implemented to address this global health challenge. Public awareness campaigns play a crucial role in educating communities about dengue prevention and control measures. Mosquito control efforts are critical to reducing dengue transmission. By eliminating breeding sites and implementing effective mosquito control measures, we can minimize the risk of dengue outbreaks. Vaccination is another key strategy in the prevention of dengue. Research and development efforts have led to the availability of dengue vaccines in some countries. Vaccination programs can help reduce the incidence and severity of dengue. Finally, international collaboration and research are essential to improve our understanding of dengue and develop effective control strategies. By working together, we can more effectively address this global health challenge. Lastly, we would like to highlight the outcomes of a significant global dengue consultation held in Geneva from 18 to 20 October 1999. The consultation brought together specialists, scientists, and public health experts in dengue and related areas. It focused on addressing the challenges posed by dengue and developing effective strategies. The main components discussed during the consultation included selective integrated vector control with community and intersectoral participation, active disease surveillance based on a strong health information system, emergency preparedness, capacity building and training, and vector control research. The purpose of the consultation was to review the global strategy for dengue control. 3 fundamental aspects were emphasized: surveillance for planning and response, disease burden reduction, and behavior change. As a result of the consultation, several recommendations were made. These included strengthening and standardizing disease reporting systems, using standard case definitions for dengue fever and dengue hemorrhagic fever, and using information for more effective program planning. It was also recommended that behavior change indicators be developed for inclusion in surveillance activities and that participatory approaches to vector control and disease management be monitored. Next, we're going to talk about rabies. Rabies is a viral disease that affects the central nervous system, or CNS. It is caused by the rabies virus and is usually transmitted by the bite or scratch of an infected animal. Several wild animals, including bats, raccoons, foxes, and skunks, can carry and transmit the virus. Domestic animals such as dogs, cats, and livestock can also become infected and transmit rabies to humans. After exposure, the incubation period for rabies varies from weeks to months. The duration depends on factors such as location of the bite and the proximity to the brain. Once the virus enters the body, it travels along nerve pathways to the brain, where it affects the central nervous system. Rabies infection can include a range of symptoms that develop over time. Initially, individuals may experience symptoms such as fever, headache, and general malaise. As the infection progresses, more severe symptoms may manifest. These may include anxiety, agitation, hallucinations, and hydrophobia, an intense fear of water. Neurological symptoms are also common in rabies cases. These can include paralysis, difficulty swallowing, and confusion. It's important to note that once symptoms of rabies appear, the disease is usually fatal. Therefore, immediate medical attention is critical if rabies is suspected. Diagnosis of rabies typically involves consideration of clinical symptoms and a history of possible exposure to a rabid animal. Laboratory tests can confirm the presence of the virus. Direct fluorescent antibody tests and reverse transcription polymerase chain reaction, or RT-PCR, are commonly used for this purpose. Once symptoms of rabies appear, there is no known cure for the disease. Therefore, prompt medical attention is critical if there has been potential exposure to the virus. Timely administration of post-exposure prophylaxis, or PEP, can prevent the onset of virus. PEP is a series of vaccinations that help protect against rabies. Vaccination plays a critical role in the prevention of rabies in pets such as dogs and cats. Regular vaccination of these animals helps reduce the risk of them contracting and transmitting the disease. PEP is recommended for people who have been bitten or scratched by an animal suspected of having rabies. Regulations in the form of policies and laws are implemented to ensure effective prevention and control. In the Philippines, the Anti-Rabies Act of 2007 was enacted. The legislation aims to prevent and control the spread of rabies by regulating the ownership, vaccination, and management of dogs and other animals at risk of transmitting the disease. Together, these measures will help reduce the incidence of rabies and protect human and animal health. Rabies is present on all continents except Antarctica and poses a significant risk to human health. Efforts to combat rabies include campaigns on prevention and responsible pet ownership. These campaigns aim to raise awareness about the importance of vaccinating pets and practicing responsible pet ownership to prevent the spread of rabies. Controlling stray animal populations and implementing vaccination programs are essential in preventing the transmission of rabies. These measures both target domestic and wild animals, reducing the risk of rabies transmission within communities. International organizations play a vital role in coordinating global efforts to combat rabies. The World Health Organization, or WHO, focuses on mass vaccination campaigns for canine rabies control, aiming to eliminate the disease at its source. Other organizations involved in rabies control include the World Organization for Animal Health, or OIE, the Global Alliance for Rabies Control, or GARC, and the Centers for Disease Control and Prevention, or CDC. Lastly, we'll discuss about snakebite envenoming as our last NTD of Don't Get Bitten series. Snakebite envenoming is caused from the injection of poison from venomous snake bites, which is a significant public health issue, particularly in tropical and subtropical regions. Snakebite envenomation leads to an estimated 81,000 to 138,000 deaths per year worldwide. This problem is prevalent in areas with high concentration of venomous snakes and limited access to proper healthcare and antivenom. Common venomous snakes that might bite people to be cautious of include the vipers, cobras, and mambas. Vipers are a group of venomous snakes that include species such as rattlesnakes, copperheads, and adders. Their venom contains a mixture of toxins that can cause tissue damage, intense pain, swallowing, and in some cases lead to hematotoxic effects affecting blood clotting. Cobras are well-known venomous snakes, easily recognizable by their iconic hooded appearance. Their venom is predominantly neurotoxic, meaning it affects the nervous system. Cobra bites can lead to paralysis, respiratory distress, and potentially fatal complications if not treated properly. Mambas are highly venomous snakes found in Africa. They possess extremely potent neurotoxic venom, primarily targeting the nervous system. Bites from mambas can result in rapid onset of symptoms, including severe respiratory distress and neurological complications. It is important to note that each species of venomous snake produces unique venom composition with varying effects. The specific symptoms and severity of envenoming can differ based on the snake species involved in the bite. Snakebite envenoming can result in both localized and systemic effects. Localized symptoms include pain, swelling, bruising, and blistering at the bite site. In addition to these localized symptoms, snakebite envenoming can also lead to systemic effects affecting the entire body. These include nausea, vomiting, dizziness, respiratory distress, bleeding disorders, and organ failure. It is important to recognize that snakebite envenoming can have lethal consequences as well. Severe envenoming can lead to permanent disability, limb amputation, and in some cases, it can be fatal. When it comes to snakebite envenoming, prompt medical intervention is crucial. Time is of the essence to mitigate the effects of venom and prevent complications. Seek immediate medical attention if bitten by a venomous snake. The primary treatment for snakebite envenoming involves the administration of antivenom. Antivenom is a specific antidote that neutralizes the venom's effects and helps alleviate symptoms. It is important to receive the appropriate antivenom as soon as possible to maximize its effectiveness. Prevention is key to reducing the risk of snakebite envenoming. Here are some essential prevention strategies to consider. First, stay informed about the venomous snakes in your area and their habitats. Learn to recognize their characteristics and understand their behavior to avoid potential encounters. Also, when in snake-prone areas, wear protective clothing such as long pants, boots, and gloves. This can help reduce the risk of a snake bite and minimize the impact if a bite does occur. In addition, take precautions to minimize the chances of encountering snakes. Be cautious in tall grass, rocky areas, and near water bodies where a snake may reside. Avoid provoking or handling snakes and be mindful of your surroundings. WHO aims to reduce snakebite deaths and disabilities globally by 2030. They recognize the urgency and importance of addressing this public health issue. Their plan focuses on several key areas to achieve this goal. These include improving access to antivenoms, strengthening healthcare systems, training healthcare providers, and raising awareness about snakebite envenoming. In line with their efforts, the Regional Action Plan for Prevention and Control of Snakebite and Venoming in Southeast Asia for the years 2022 to 2030 was published in December. The plan was launched in New Delhi, India. This Regional Action Plan builds on the 2019 Global Strategy and aims to accelerate efforts in the Southeast Asia region to halve the numbers of deaths and disabilities caused by snakebites by 2030. By focusing on improving access to antivenoms, strengthening healthcare systems, training providers, and raising awareness, WHO and its partners are working towards reducing the burden of snakebite envenoming and improving outcomes for affected individuals. Thank you so much for watching our video on Don't Get Bitten, NTD's intro series. Today, we discussed 3 crucial NTDs, including dengue fever, rabies, and snakebite envenoming. If you have any questions regarding these topics, please feel free to comment on this video, and then we'll try our best to respond in details and in timely manner. If you enjoyed this video and would like to get more information about different types of NTDs, please subscribe and like this video.